Hello, and let's talk about fibroids today. Fibroids are a very common experience for women in their 30s, 40s, 50s, and thereafter. Our gynecologists will tell you that fibroids are benign growths which occur in our uteruses, and they are stimulated, their growth is stimulated by estrogens, and they get bigger and smaller with the fluctuations of the hormones during the cycle. Also, as we get older and enter menopause, most of them disappear. The problem is right around menopause when most fibroids become big and they start bleeding. They don't turn to cancer. There's nothing to worry about in that area. The question really becomes, what do you do about them when they're big and you feel like you're 6 months pregnant, and when they're making you bleed every 2 weeks and you become anemic and need iron all the time? So there are a few options. One of them is to use progesterone, the bioidentical progesterone, and that may help you reduce the bleeding, decrease the bleeding. There are also hormones like Provera, which are synthetic, non-identical, non-human identical hormones that may cut back on the bleeding. And then you can try to regulate the bleeding. Birth control pills usually do not help with that. They also suppress your hormone production, and they make you feel even more menopausal. So trying hormones and also cleaning your diet, cutting back on alcohol, on caffeine and other stimulants, not overdoing exercise when you're bleeding a lot, getting enough sleep, by which I mean 7-8 hours a night, and dealing with stress, because sometimes hormones and stress obviously will increase the fibroid size and make you bleed more. There are ways to remove the fibroids, which are called myomectomies, where they just take out the fibroid. There are arterial embolizations, which will just cut off the blood supply to the fibroids. And there are also just hysterectomies. I think hysterectomy is the last-ditch effort. I think because hormonally, if you balance your hormones correctly and wait, eventually your fibroids will disappear. And every woman, even if you are postmenopausal, the uterus is part of your body, and you don't not need it because you're not having babies anymore. So please think twice before doing anything invasive, because once you have a hysterectomy, you will go into menopause, and once you have a major surgery, you can't take it back. So fibroids, in summary, they're not anything that will turn to cancer, and if you can deal with the bleeding and hormonally balance yourself, you will get rid of them. Your body is a beautiful thing and will get rid of it. Thank you.